We are recording live for BlackMentalHealthNet.com, and today we are with Dr. Xenia Johnson. If you could, please introduce yourself.
Good morning. This is Dr. Xenia Johnson. I'm a pediatric psychiatrist at the Cambridge Health Alliance. I practice in community psychiatry and have been practicing in the community for 12 years now.
For our first question, is suicide a problem in the black community?
Yes. The rate of suicide has increased in the black community since about 1990. The major cause of suicide in the black community is depression, like it is in many other communities. However, the risk factors that attribute to suicide in the black community and the increased depression rates in the black community are different than in other communities. Different risk factors such as income, education, employment, access to substances and substance use, and even firearms increases the rate of suicide in the black community than in other communities in ways it does not affect others.
What age groups are more susceptible to suicide?
Suicide is the number 3 killer of African Americans between the age of 15 and 24. There also seems to be an increasing rate of suicide in the elderly, those under 65. We aren't quite sure what the determinants are as to why these increased rates in these age groups, but indicators such as social isolation and underemployment seem to be linked at this point.
Now, why are women less likely to succeed in suicide attempts?
Suicide attempts are common in both men and women, but they're more often seen in women. The thought is that suicide itself is a solution to a problem. Suicide attempts are as an attempt to bring attention to a problem. Women more oftentimes tend to share and are more verbal in discussing their problems and looking for solutions to their problems. As a result, suicide attempts are more likely with women than they are with men.
What is the best course of action if you think someone is considering suicide?
The best course of action is to first empathize and then help. Empathy is a big word that only means non-conditional or unjudgmental acceptance. What you want to do then is, if you see someone who you consider contemplating or you think may be contemplating suicide, you would ask, how's it going for you? You look like things are down for you. It must be hard. You're handling a lot right now. These sorts of statements are empathetic statements, non-judgmental accepting statements of the person's position at that point. Once they then open up to you, then you offer help and say, what can we do to help you get to a different place than where you are right now? You might suggest then going to a counselor, going to their primary care physician, or if it's emergent, even going to the emergency room.
What are the signs that a person is considering suicide?
The signs of suicide are much like the signs of depression. They include things like isolation or withdrawal from public, spending lots of time alone. They also include decrease in interest or usual things that are enjoyable to you, decreased energy, where you're always sleepy or always sleeping and tired, and then mostly for suicide, though, there's also the degree of hopelessness that presents, feeling like there's no future. The projected outlook for you seems grim and bleak. So while these are all indicators of suicide and are pretty poignant, there's one also that's quite deceptive, and that's a shift from that place of being distraught or dismayed to being more active inexplicably. That's also an indicator of suicide, because it could be that the person has come to a deliberate consideration about their plan around suicide. That is an indicator, oftentimes, that they've found peace with this idea, and imminent termination of their life might occur. So I would seek help for that person then.
Why are some behaviors such as alcohol or drug use considered a slow form of suicide?
So suicide by definition is a deliberate act of self-destruction. Alcohol and substance abuse, while not often seen as signs of suicide, are acts of self-destruction. They just occur over months, days, weeks, and years. And without the intent to seek help for those behaviors and those choices around substance use, inevitably they are slow forms of death.
Why does suicide tend to be contagious or run in families?
Our first experience of managing painful or difficult situations tends to occur in the context of our families. We watch those who are around us manage the most triumphant moments or the most successful moments, but we also see examples of how those around us manage the most stressful and distressing moments. And those times are key modeling moments for how we manage difficulties around us. That's in some part why suicide may be linked in families. As well, however, depression is a biological entity, and as such, it's inheritable and runs in families, such that those who do commit suicide may be at increased risk of having family members who have depression and then may also lend themselves to suicide as well.
What are the most common reasons that blacks commit suicide?
Now here's where blacks and others tend to be similar. Blacks, like many others, commit suicide more often related to mental illness, and more often that mental illness is a mood disorder such as depression. The problem, however, in the black community is that the stigma that goes along with mental illness makes those really reticent or reluctant to seek help for their mental illness. Therefore, more likely than to not get the treatment that might be aiding them to resolve their depression in other ways besides suicide.
Is suicide more frequent among isolated individuals?
That's correct. Studies have shown that those individuals who spend more time alone or who are isolated in their community tend to have higher rates of suicide. And we've also shown that those individuals who pursue relationships and who are able to pursue help through others actually improve their depressive symptoms as well as their overall life quality.
Dr. Johnson, thank you so much for your time, and thank you for tuning in to BlackMentalHealthNet.com.